we have a renowned Panchakarma expert from Karnataka, Dr. Shripati Adiga, who is presently working as an associate professor in the Center of Integrative Medicine Research, Manipal Academy of Higher Institutes, that is Manipal University. And Dr. Shripati Adiga, it is my pleasure to introduce him. Dr. Shripati Adiga has completed his MD from the renowned Ayurveda Institute, that is Government Ayurveda College, Trivandrum. And after that, he was working in the SDM also as assistant professor. And after he has gained immense confidence in the practice of authentic Ayurveda as an expert teacher and experienced practitioner of this holistic science. Dr. Adiga has made on attempts to establish the realism of Indian classics with modern contemporary parameters through his literary and clinical researches. He has presented many papers, delivered guest lectures, and chaired several sessions at national and international platforms. He has several publications on his name, and Dr. Adiga is presently involved in several research projects on neurodegenerative disorders.
First of all, I thank Dr. Rajkala Madam for giving this wonderful opportunity to share some of the thoughts in this particular area. And when Madam told that it will be something like a very, very unique idea, so that she'll be bringing lot of inputs in the field of practice of Panchakarma through various practitioners. Really, I was very happy. And she also presented, Madam presented like a topic is something to do with the Prakriti and Panchakarma, which is a very important part of the Panchakarma nowadays. And when we talk about applications of the concept of Prakriti in the Panchakarma, we have to be should be having a very good idea regarding how actually Prakriti is understood in classics. Basically, Prakriti is a Swabhava, something like, which is natural. Shastra says that it is, at the time of Shukra Shonita Sanyoge Kukshi Garbha Samnya. So then only actually the Prakriti concept starts. And definitely when we see the entire Shastra, especially in the Vimanasthanam, when it comes to the Rogi Pariksha, Atura Pariksha, so the first of all, under the Rogi Pariksha, Prakrita, Vikrita, Sarata, Sammanata, etc., the Prakriti comes the first. What needs to be understood as a normalcy for that particular person. Okay. And of course, when you talk about Prakriti, we need not be, very many times we will be under the impression that Prakriti is something like Vata, Pitta, Kapha, and all sort of the 7 varieties of the Doshik Prakritis, which are mentioned in the Shastra. More than that, actually, we have to also include, which is something like, Kala Garbhashe Prakriti, Atura Ahara Vihara Prakriti, Mahabhuta Vikriti Prakriti, and Garbha Sharira. So all of them can also be, taken into consideration when we talk about when we analyze the importance of the Prakriti with respect to the Panchakarma practice. And mostly, when it comes to the Doshik dominance of the Prakritis, mostly we understand that Kechit Vatalaha, Kechit Pittalaha, so Kechit Shleshmalaha, something like that. Acharya has given an input regarding that. And Ashtanga Sangraha very beautifully highlights, like, what do you call a Sapta type of Prakriti, Sapta Prakritis. Jati, Kula, Desha, Kala, Vayu, Bala, Pratyatma Samshrayaha Drishyante hi Purushanam, Jatyadi Niyataste Bhava Visheshaha. When we see this, there are various important inputs which we can see, like especially when you talk about Jati. Of course, nothing to do with the casteism here. It is something to do with how actually the people are born and brought up. like, physically, psychologically, how much, the Panchakarma can be applied in this particular group of people. That's how actually we are supposed to be understanding this. When we go through the clinical practice, especially the Mehtas or Hutchinsons or various other things, when we're taking the case history, we'll be taking the the entire history of the particular person, including the the gender, age, then the nationality, race, everything, right? So everything matters when it comes to the clinical practice. Rightly, the Ayurveda also has taken into consideration all of them. Like, when you talk about the Prakriti, you are supposed to understand many factors. And very interestingly, like in the commentary, Shashilekha commentary, he very clearly gives an idea. Like certain group of people, they are from the birth, they are Madhura, Praya, Ahara, Ruchi, Rasa, and Sahasika. The profession of the particular group of people can bring about some amount of sukumaratva in the particular people. And some of them, if they are from the background of the shastra, the samatvad yukto, so if they are practiced by profession, if they are belonging to something like the very laborer kind of thing, very strongly physical involvement is there, then their physical capacity to tolerate certain things, especially the Panchakarma, is something different. And the Kulenaiva, from the by birth, some of them may be having some accustomization. There is some dietary accustomization or the physical capacity to do some work. There is special type of dietary involvement may be there in a certain class of people. So with all those things, the application of the Panchakarmas in this group of people may vary from group of people to the group of people. And we are supposed to be very clear in this particular area where he mentions that Tikshnadipati Banapi Kalavat Guna Kala Pani Vibhitvanyantevam Adichintyam. So you are supposed to be very clear in application of Panchakarma in a certain type of Prakritis, whether it is Prakriti belonging to the Jati, Prakriti belonging to the Kula, or the Desha. Desha also matters. The geographical location in which where he is where has taken birth, and also where he is living. And definitely we see that when we are applying Panchakarma to the different national people, like whether they are coming from the European countries, whether they are coming from the old USSR, Russia, or they belonging to the America, then application of the Panchakarma will be different in different people. We see that in clinical practice, when it comes to the Snehapanam, for a certain group of people, it is very easy. They can do the Snehapanam very easily. We see that in most of the people, those who belonging to the old USSR or the Russian countries, when we give them the Snehapanam, 90% of the people, very easily they can do the Snehapanam, whereas for ourselves, when it comes to the Indians, we feel it's a very tough job for us. So also when it comes to the the Panchakarma therapies with respect to the Vasti, the Tikshna Vastis, the quantity of the Vastis can it can be really relative to the group of people where you are going to apply. Like especially in the, I told you, the Russian group of people, they can tolerate the enemas very good. Whereas the other people, it's not so easy to tolerate the enemas. And also when, from Indian point of view also, the geographical location, that makes a lot of impact on the practice of Panchakarma. And Kala, Vayo, Balanamapi, Vacha. What about the Kala? So, the season wise, like we'll be discussing it in the coming slides, definitely. So, Prakriti is something more than simply like having only the Vata, Pitta, Kapha Prakriti only need not be considered here. But definitely, most of the our medications or the Panchakarma applications, most of them we focus on the Prakritis based on the doshas. And also, in general, we are supposed to identify this particular very key areas where actually you are supposed to give some thoughts so that your Panchakarma practice will be highly successful and without much complications. So these are all the important areas which actually Ayurveda, especially the acharyas, they have given a very good inputs where we are supposed to elaborate, we are supposed to identify the facts and then practice Panchakarma. Coming to the doshic understanding of the Prakritis, we know that the all the introduction of the Prakriti, I don't need not give it because everybody knows it. But to highlight some of the the key areas which are mentioned in the Vata Prakriti or Pitta Prakriti, Kapha Prakriti, something like the usually Vata Prakriti people, they are mostly the Ruksha dominant in the Sharira. And also some of them are having Alpa Nidra, Jagarukascha they say. And there will be always a chance that there can be a Vata Prakopa in any given point of time. And we have to be very careful in doing some of the therapies in this type of people. Like, if you are practicing a Vasti, continuously the Niruva Vasti, there is every chance that there can be some Vata Prakopa in a due course of time. Or if you are practicing the Ruksha Swedas, then also there is a chance of Vata Prakopa in the people. And when you are doing Snehana in this group of people, so getting Samyas in the Lakshanas may be slightly delayed or may be difficult also. Because of the reason that by nature, by Prakriti, the group of people, they are actually Ruksha Pradhanas because of the Prakriti. And coming to the Pitta Prakriti Lakshanas, this is very important where because most of the times in the clinical practice, when we are practicing the Panchakarma, most of the complications comes in the Pitta Prakriti people. Because of the reason that if you see the very important inputs from the Shastra, Tasya Ushnyat Pittala Bhavanti Ushna Asaha. They will not be in a position to tolerate the Ushna Guna. Ushna Guna with respect to the Dravya or Ushna Guna with respect to the Bahya Upachara. So all of them are also needs to be considered. And there will be Sukumarata in them and Chut Pipasa Asavantaha. They cannot be in a position to tolerate the Chut and Pipasa. And rightly, we see a lot of complications or a lot of issues when we are practicing the Panchakarma in the Pitta Prakriti group of people. They say that it is basically Madhya Balaha. They are the moderately built and moderately strong people. And we are supposed to understand it very clearly. And I will come to this particular, the practice of Panchakarma with respect to the Pitta group of people in the coming slide, so that I can elaborate there. Coming to the Shleshma Prakriti, they are the people, those who can really tolerate some of the Panchakarmas very easily, because they are the people where strength is very good, and the Sara is also very good, and basically because of the Shleshma Guna in them, so most of the Panchakarmas, they are able to tolerate it very well. Because it is very clearly mentioned that Panchakarmas are the one which is going to induce some amount of discomfort in the people. It is not that Panchakarma can be practiced without any discomfort. Because whether it is in the Vamana context or in the Virechana or the Vasti, Nati Mahati Vyata. Na Ati Mahati Vyata. Vyata is supposed to happen during the practice of Panchakarma. Because you can't, expel the doshas out of the body without any of the discomfort. So Vyata is bound to happen, but it should not be na ati mahati Vyata. That's what in the context of Panchakarmas it is very clearly mentioned. So when we talk about that, the group of people, those who are undergoing Panchakarma, should be in a position to tolerate it. That is the idea behind the focusing on the Prakriti concept. Like these are all various features which we see it in the clinical practice to identify whether they belong to Vata, Pitta or Kapha Prakriti. Because we see that many a times general clinical practice, we will not spare much time in diagnosis of the Prakriti. Because if you go by the classical inputs and also the different softwares are there or different proformas are there, where more than 40-50 questionnaires are there to pick up the Prakriti of the person itself. So in a busy schedule, when you are in a OPD, it becomes very difficult to appropriately go through each and every question and come to a conclusion that this person belongs to a Prakriti of Vata, Pitta or Pitta Kapha or Kapha Pitta, like that 7 Prakritis. So it's not so easy. So some of the very important points you can pick up and ask relevant questions in the patient to see that you will come to the approximately 80 to 90% approximately right selection or the right diagnosis of the Prakriti. And you can also use your pulse examination for the particular understanding of the Prakriti. And also you can ask some of the questions to see. And definitely the experience of the physician makes it very quicker understanding about the Prakriti. And 80 to 90% should be accurate enough to identify the Prakriti properly. When it comes to importance of the Prakriti with respect to the Panchakarma, we should know that always there is a clear understanding in the Shastra how to divide a person or a patient based on the bala of the patient. Bala Vishesham Vibhajet. Basically, he says that Pravara, Madhya and Avara Vibhagena. You're supposed to make the person or a patient group under whether he belongs to the Pravara group of patient, Madhyama or the Avara Bala. And what all the clinical points you're supposed to see? Basically, starts with the Prakriti. Prakriti. Then, of course, the Vikriti is also there. You're supposed to group the patient under the Pravara, Madhyama and Avara group. And tato vaishajyasya tikshna mridu madhya vibhagena traividyam vibhajya yatadosham vaishajyam avacharayet. So also it is applicable to the Panchakarma also. If the Prakriti of the patient and all of them will bring it to the Pravara Bala, Madhyama Bala and Avara Bala, then Panchakarma also needs to be practiced in the similar line. Pravara Shuddhi, Madhyama Shuddhi and Avara Shuddhi. And Taswad Viparita Gunena Vidina Doshopakramaniyoktena Nanupacharet Sama Sarvarasena Satmena Antyam Yatarutu Vihitena Cha. This particular shloka from the Ashtanga Sangraham, which elaborates, that is, there are various prakritis which we understood, like Vata, Pitta, Kapha, etc. And when the particular group of Prakriti is identified in a patient, then application of the therapy is also very important. Like, in Vata type of Prakriti, if you identify, then the Chikitsa also, like, how it is explained in the Doshopakramani Adhyaya, like Vata Doshaja, Vata Chikitsa, Vatasya Upakramaha. So you are supposed to identify that and then adopt the Chikitsa Sutra. It doesn't mean that you're not supposed to focus on the Vyadi. You're supposed to balance the concept of the Prakriti in treating the particular Vyadi itself. Like, Vyadi Chikitsa is the most important. At the same time, when you are applying the Panchakarma concept in the particular Vyadi, then dosha plays a major role. It is the dosha pratyanika chikitsa which you are doing. And how to do the dosha pratyanika chikitsa in a Vyadi, to what extent, will be dependent on the Prakriti also. Of course, there are several factors to play there, but Prakriti also plays a major role. To what extent you can go in the dosha pratyanika chikitsa, especially when it comes to a particular group of Prakriti. And he says, doshopakramani uktena vidanaina upacharet. So if it is the Vata Pradhana Prakriti, then Vatasya Upakramaha Snehanam, all those things. So at the same time, you are supposed to also focus on the disease, which is the Vyadi. And what is the Chikitsa Sutra of the particular Vyadi? Both of them needs to be balanced. Antyam punaha sarva samaprakrtikam samasarva rasena satmena upacharetiti. If a Prakriti of the person is, we got it as a, the balanced one, then it is very easy. You can go with the Madhyama type of Chikitsa. And also you are supposed to understand that when you are treating a particular dominant Prakriti, Vata Prakriti or Pitta Prakriti, Kapha Prakriti person, when you are doing it a Panchakarma Chikitsa, your entire, the application of the Panchakarma also should take some leads from the Rutucharya. Because it is said that when Rutu Chakra is going on, especially the all the Rutus, starting from the Hemanta, Shishira, Vasanta, etc. In each Rutu, we find that Chaya, Prakopa, and the Prashamana of the particular dosha is happening in a continuous way. And we find that in one particular Rutus, there is a dosha Prakopa. And Acharya has very clearly mentioned that there are certain sadharana Rutus in which the Panchakarmas are very, very good to execute. But may not be in some of the other Rutus. Like we see that in the Charakas very clearly mentions, that is Hemanta, Grishma, Varshashcheti, Shitoshna, Varsha Lakshanas, Traya Rutavo Bhavanti. They are the dominant of a particular Shita, Ushna or Varsha Lakshanas. So in these particular Rutus, we find there is a Shita Guna dominant or Ushna Guna dominance basically in the Hemanta and Grishma. Of course, if it is the Shishira, and also if it is with the Grishma, we find, and there is a dominance of the Ushna Guna or the Shita Guna. So if that is applicable, then we are also supposed to see that there is a need to focus on Pitta as well as the Kapha, or where we are supposed to identify. So Kapha and Pitta are the one which needs to be focused there, and then the Panchakarma should be applied. But in the Sadharana Rutus, we see that Pravrat, Sharat, Vasanta, easily you can apply the Panchakarma because there is no much deviation from the temperature point of view or the Rutu Lakshana point of view. There is no extremes here. They are the Sadharana Rutus. And beautifully the Panchakarma can be practiced. But apart from this, even though you are practicing in the Hemanta, Grishma, Varsha, etc., then Acharya, when it comes to the Atyayika Chikitsa, Acharya himself gives you permission that you can practice it, because if it is an Atyayika condition, then the Kritrima Gunadhanena, you are supposed to artificially create an atmosphere so that the Panchakarma practice will not be obstructed or disturbed. And when it comes to various, the importance of the Sattva, the the focus on the mind. So we know that in the different Prakritis, the strength of the mind or the Manobala or the Sattvabala is different. In the previous slide only we have seen what about the Vata Prakriti, what about the Pitta Prakriti, and what about the Kapha Prakriti. Usually Kapha Prakriti people are those who have the the highest willpower as well as the Sharira Bala to tolerate the Panchakarma. Whereas when it comes to the Pitta Prakriti people, so usually it is good willpower is there, but at the same time the Sharira is a Sukumara Avadata Sharira. And when it comes to the Vata Prakriti, definitely the Sattva Bala will be highly weaker. Because of the reason that, the gunas of the doshas will have a, deciding point in assessment of the behavior of the people. So Sattva assessment also will be based on the, of course, the Prakriti itself. And when it comes to the Amanirama Lakshanas, we are also supposed to focus on some of the Amanirama Lakshanas based on the Vata Pitta Kapha. Of course, it is nothing to do with the Prakriti here. What I am talking is actually it's about the Vikriti itself. But when you are giving some Deepana Pachana Dravyas on the basis of the Amanirama Lakshanas which we have identified in the Rogi, then the Deepana Pachana Dravyas also will depend upon the doshic dominance, whether it is a Samamata, Samapitta, Samakafa, and also it is related to the Prakriti of the person again. Because we see that in the Amalakshanas, when Vata, Samavata Lakshanas are identified, or Samapitta especially, then most of the times the Pitta, if it is present, at the same time, when you are practicing the Panchakarma in a particular Prakriti, then we are supposed to understand that if a person belongs to the Pitta Prakriti, then the selection of the medicines for the Deepana Pachana also will vary. Of course, mostly dependent on the doshic dominance. Also, we are supposed to focus on the Prakriti of the person also. Because of the reason that in the various list of the Deepana Pachana Dravyas, we will come across lot of medicines. Whether it is a simple Ashtachurna, or there is a Bhaskara Churna, Vipatti Churna, or various. Of course, many times, even in the Shastra, it is said, even you can use some of the Pachana Dravyas, especially the Shamana Aushadhis which are mentioned in the particular context can also be used for the Deepana Pachana purpose. In the same line, when we talk about the Deepana Pachana, we know that in the context of Samavata, there is a need of Vatanulomana, etc. And you can use, especially like, Bhaskara Lavana Churna, Ashtachurna, etc. Dravyas, because of the reason that they do contain some of the particular Dravyas which have a Vatanulomana property. At the same time, it doesn't provoke the Vata in the Sharira, and also they are well tolerated by the patient. In practice of the Deepana Pachana with respect to Samapitta, we should always focus on Dravyas which are Tiktarasa dominant. Because it is in the Atre Bhadrakape Adhyaya, when we talk about the effect of rasas on the particular doshas or the Sharira, we see that Tiktarasa is the one Swayam Aruchishnopi, even though it is not so tasty, but it produces the taste in the Sharira. At the same time, Tiktarasa is considered as the best Amapachaka. So it is also a Pitta Shamana. So you can use multiple Dravyas which are having Tiktarasa in it. Tiktaka Kashaya is maybe the one of the example. Even you can use the other Dravyas which are having the Tiktarasa dominant. Many times Avipatti Churnam, even though it is not directly indicated as a Deepana Pachana Dravya, so it can be used for the Deepana Pachana purpose because it is the one which is indicated in the Alpagni. Because it is having the Pitta Shamana property in it. When it comes to the Sama Kapha, so you are supposed to focus on the Ushna Tikshna Dravyas like the Trikatu, Panchakola, etc. can be used for the particular purpose. I'm giving in this particular area. This is basically nothing to do with the Prakriti directly, but definitely it has got a relevance in the clinical practice when a person having the particular Sama Lakshanas of the Vata Pitta Kapha, when you intend to give some medication, always you are supposed to focus on the Prakriti of the person. Whether the person is belonging to the particular Prakriti can tolerate your Deepana Pachan Dravyas or not. That is also very important. And when it comes to the Kala, like Rutus, in the previous slide we have discussed, where in the Grishma Rutu or in the Hemanta, etc., where the extremes of the temperature are seen, then the particular group of Prakriti persons will not be in a position to tolerate it, whereas the other persons can tolerate it very easily. Like for example, a Pitta Prakriti person will be finding very hard time to tolerate the Grishma Rutu. It may not be applicable to the Kapha Prakriti person. So while practicing Panchakarma in such Prakriti persons, in that particular Rutu, you should be extremely careful. So that is the idea behind identifying the importance of the Kala. What about the Koshta? Koshta is very important with respect to the Panchakarma, because rightly Acharya says, Koshtam Vibhajya Vaishajyam Datyat. Entire application of the medicines, the dosage of the medicine will depend upon the Koshta. Even though in the Shastra, there is no direct relevance or the direct connectivity between the Prakriti and the Koshta, but there are practical inputs in our clinical practice. We find that a Pitta Prakriti person is almost connected to the Mrudu Koshta, and a Kapha Prakriti person is connected to the Madhyama Koshta, and Vata Prakriti person is connected to the Krura Koshta. Some of the researchers are also pointing towards that. And when it comes to the particular Prakriti and Koshta, administration of the medicine with respect to the practice of Panchakarma is you should be extremely careful. If you are able to sense that particular person is Pitta Prakriti or the Mrudu Koshta person, your entire practice of Panchakarma should be highly careful. Many times we see that when we administer the Virechana Dravya in a Mrudu Koshta person, by mistake, larger quantity or the very strong medication when you administer, we land up in the Ati Yoga. And giving Alpa Aushadha and Alpa Bala Aushadha in a Madhyama Koshta person will make the Ayoga. And same thing is applicable in the Vasti practice also. By mistake, if your selection of the Rogi with respect to the Koshta is a Mrudu Koshta patient, and if we are unable to identify the Koshta of the patient, many times the Tikshna Vastis which are considering the involving the Gomutra in it, or Kshara in it, or any of the Tikshna Dravyas in it, can cause very severe abdomen pain. Very severe abdomen pain and cramps in the abdomen and Atiyoga of the particular Vasti practice in them. We have seen in the clinical practice that patient even in requirement of sudden involvement of the allopathic medicine also. To that extent, actually, identifying the Koshta is very important. And of course, we see that with respect to the Prakriti, Kashta Sayushnata varies, where the Kapha Prakriti people can tolerate the any of the physical and psychological or the psychological stress to the maximum extent, whereas it is very least in the context of Pitta and Vata. And Sukumarata is also same. And when it comes to the Dravya Guna point of view, Prakriti plays a major role. Because most of the times we see that most of the dravyas which we use it in the clinical practice, especially like the ballataka like dravyas. Acharya says that ballatakani tikshna agnipakini agnisamani cha, and so you are supposed to be very careful while using the ballataka preparations. Where is the drug ballataka comes in the Panchakarma practice? Because many times we, it skips out of our mind that most of the Panchakarma dravyas, including the Deepana Pachana dravyas or Rokshana dravyas or the Snehana dravyas. This particular drug, the Gogulu Tiktaka Gratam, which is a wonder drug, I would say. Because the combination of the dravyas in such a fantastic way, if you see the Falashruti of the Gogulu Tiktaka Grata, you will be in love with that. Because it can address the diseases which are considered as like, the non-curable conditions or very severely affecting the patient. Such kind of dravya, the diseases are indicated in the Falashruti of the Gogulu Tiktaka Gratam. It's not an exaggeration. It is a wonder drug. It can be used in such clinical conditions very easily. And it gives an immense result also. What needs to be, you should be cautious is where you are using. Which is the prakriti of the rogi. Which is the prakriti of the patient, which you are using it. One. Second one is, of course, the doshic dominance. Which is the doshic dominance of the particular clinical condition in which you are using the particular drug. And the third important point is, which is the Rutu. So this is very important aspect of the Panchakarma practice. In the clinical practice experience, we have seen several cases, those who have a hypersensitivity to the Gogulu Tiktaka Gratam. Whether it is while doing the Snehapanam or in the Vasti also. Especially in the Snehapanam. Initially, when we are giving Snehapanam, usually if the patient is tolerable, 1 or 2 days there will be no much issues. But after the third day of Snehapanam, they will slowly develop some amount of nausea, vomiting sensation, headache, and very important complication of the Gogulu Tiktaka Gratam comes with itching over the skin. Severe kind of the kandu, daha, and redness. Rashes over the body. Starts with the milder rashes over the palm or the legs and the abdomen. But if you are unable to identify it, immediately it can spread to the entire body and it will be so severe. With even the allopathic medicine, sometimes the itching and burning sensation will not come under control. And you can say that whether it is a faulty practice of the physician or it is the Rutu which can have contributed to it. There are many aspects in this particular area, but still even though you are able to identify the prakriti, you are able to identify the kosta, everything properly, there is every chance that we may miss it. Because Acharya says that buddhi makuli kuriyat, the permutation and combination of so many things in the Panchakarma. Agnivesha rightly asked the Acharya that even though there are a good number of indications and contraindications, everything you are telling, but still, why actually we are supposed to understand the vyapats, possibility of the vyapat? Then the Acharya says that, so because the permutation combination of the Panchakarma selection criteria, everything is so high that there is every chance that you may face the complication. Upayam chintayin prajnaya apayam api chintayet. So, you are supposed to see that Gogulu Tiktaka Gratam, you should understand that even though it is a wonder drug, it can produce lot of issues because of the presence of the Ballataka in it. whether it happened due to the improper preparation of the Gugulu Tiktaka Grata or due to the hypersensitivity of the particular patient. So it's a matter of debate, because we don't know like how some of the gratas are prepared in a pharmaceutical setup, whether all the measures of the particular shodhana of the Pallataka is taken care or not. Okay, so when it comes to the clinical practice, we find it lot of complications with the Gugulu Tiktaka Gratam, and we have managed successfully. So initially, in some of the cases, we took the help of the allopathic medicine, but later we are able to manage with the Ayurvedic medicines. So you are supposed to focus on the Pitta Chikitsa, Ballataka Chikitsa. You will get very good improvement within 3-4 days. But at the very important thing is you are supposed to discontinue the Snehapana with the Gokulu Tiktaka. You can change over. There is a possibility of changing of the Snehapanam, even though it may not be a good practice, but you are supposed to go on, because of the reason that, nowadays Panchakarma practice is not so easy. You are supposed to finish off the entire Panchakarma within a speculated period of time, because general public, the common man, don't have that many long time to focus on only Panchakarma therapy. They don't get such a huge number of days of leave. So you are supposed to complete it in a given duration of time. So when it comes to that, you are supposed to change over the Snehapanam with any of the other Tiktaka rasa dominant Snehapanam, like Tiktaka Krita, Maha Tiktaka Krita, etc. And also we are practicing some of the other type of practice in order to take precautions to avoid the Gugulu Tiktaka Krita's complications. That we are doing some amount of combination of the Gritas when we are doing the Snehapana. So Gugulu Tiktaka Kritam in combination with the Tiktaka or Maha Tiktaka Kritam can to some extent avoid the chances of getting complications because of the presence of the Tiktaka and Maha Tiktaka Krita's Pittahara property. So this is how actually some of the the combinations can be done, so that you can minimize the chances of getting the complications with the Gugulu Tiktaka Krita. Okay, so the Chikitsa can be with the Tiktaka Kashayam or Maha Tiktaka Kashayam. If you are able to, if you need to stop the Panchakarma Chikitsa, then how to manage the Vyapat, Pittahara Chikitsa with the Tiktaka Kashayam, Maha Tiktaka Kashayam, Sutashekharasam, or Avipatti Churnam. There are so many medicines which you can use. So that is how actually a complication of this particular type of Gritam which can arise, you can manage it. There is one more Thailam, which is Prasaranyadi Thailam. You believe it or not, even though Prasaranyadi Thailam in the Vasti Chikitsa or any other Chikitsa may not produce any of the much complications, but when the same Prasaranyadi Thailam is used externally in the Pitta Prakriti person or in the Grishma Rutu, especially when there is Pitta dominant chances are there, and also when you are using the same Prasaranyadi Thailam in the Nasyam, can give rise to severe burning sensation and itching over the area of exposure. If it is the skin there, if it is Nasyam also in the upper part of the body, there is a chance of burning sensation and itching. Again, there is a presence of Ballataka in the particular Thailam. So that is again one of the reasons. So the management strategy, definitely, so the Pittahara Chikitsa with respect to the Pitta Prakriti person, how it should be done, the same thing should be adopted. Another Gritam which commonly gives us the complication is the Varunadi Gritam. So same thing, here also we have one of the main ingredient which is nothing but Ballataka. And same Pitta Prakriti person with the Grishma Rutu's association can give rise to some of the complications. So similar like the itching, rashes all over the body, and a similar line of management can be used in the management of the complications. And coming to the involvement of the Prakriti with respect to the various major Pradhana Karmas. Like when you talk about Vamana, we know that in the Kapha Prakriti person, Kapha Pradhana doshas, etc., the Urdhva Kaya of the Sharira when doshas are present. Vamana will be a better choice. And Ashtanga Sangraha very clearly mentions the Sthanagate Pitteva. Means Kapha Sthanagate Pitte also, Vamana can be a right choice. And rightly, when the Kapha Prakriti person is there, then the Vamana will be very easy. That means the Vegas will naturally come out. It will not be Ruksha Vegas, it will not be Kritra Vegas, and Vamana will be a right choice in the Kapha Prakriti person. Of course, when we see the Kapha Prakriti is, some of the adverse benefits, we see that Kapha Prakriti people are very prone for the Prameha, Staulya, etc. etc. And if you see the Chikitsa Sutra of the same Vyadis, Vamana is one of the major line of management. Of course, not in the Atistula Avastha. And Vamana can be a very good choice in the Kapha Prakriti person. And when you talk about the Vamanas, in the Prakriti Anusara, especially Kapha Prakriti person, and in the Vasanta Rutu, because many a times the preventive line of management is ignored by us. So if we know that people belong to the Kapha Prakriti person, then we should educate the patient that you should undergo Vamana therapy in the Vasanta Rutu. So Prakriti can be linked to the Doshik dominance and Rutucharya. So Rutucharya and particularly the Prakriti go hand in hand, and they have a very good relevance in the Rutucharya or Rutu Anusara Panchakarma. As I told you, in case of Virechana, Pitta dominancy and Sharad Rutu. Pitta Prakriti person and Sharad Rutu should be focused on, because people, those who belong to the Pitta Prakriti, they are prone for certain disorders of the Pitta. Whether it is a bleeding disorder, whether it is a skin related pigmentation, hyperpigmentation, etc., or whether it is related to the Kalitya, Palitya, etc. So the practice of Panchakarma, especially Virechana, in the Sharad Rutu, Sharadi Virechanam, should be focused on, should be highlighted in this group of people, if they are in the Prakritavastha. That means there is no disease as such, but even though you are supposed to focus in this particular angle. What is the relevance of Vamana Virechana with respect to the Prakriti, with respect to a clinical condition? When you are applying the Virechana Dravya in a patient, those who belong to the Pitta Prakriti, as I told you in the previously, there is a very good association between the Prakriti and the Koshta. If the person is belonging to the Pitta Prakriti, then there is a higher chance of having the Murdu Koshta Avastha. And when you are practicing the Virechana in these people, your selection of the Dravya, dosage also should be properly calibrated, properly measured. So whether you can apply higher dosage of the medicine in these people or not, you should be giving the second thought. And also the Vasti practice, whether the Tikshna Vasti can be done in the Pitta Prakriti person or not, or the Vasti Dravya which are having Ushna, Tikshna and Gomutrita Tikshna Vastis can be applied in the Kapha Prakriti person. It's a highly relevant point to focus on. And also the Nasyam. Coming to the Bahya Upakramas, of course, there are a lot of Bahya Upakramas which depending on the Prakriti, depending on the Rutus. Of course, I don't say that it is only due to the Prakriti which is which should be given importance. Of course, the Rutu and hypersensitivity of the particular person. We are using so many Udvartana Dravyas, including the Kola Kulatadi Churnam, along with the Dhanyamla, etc. We found a lot of the adverse reactions with the usage of such combinations, Ushna Tikshna Dravyas. When you are doing it in a Pitta Prakriti person with the hypersensitivity to these things, there is a itching and rashes all over the body after starting the particular practice, Udvartana. And also we have a lot of lepas, including the Dashanga lepa, including the lot of Ushna Tikshna lepas, Kotam Chukadi lepas, etc. can produce hyper reaction in some of the Pitta dominant people. Pinda Swedas of the Churna Pinda Swedas or the Jambira Pinda Sweda, many times, even to that extent that in the Jambira Pinda Sweda, when we are using the Ushna Tikshna Tailas for the Pinda Swedas, that can also bring about some amount of hyper reaction, hypersensitivity. There are some Tailas which are used for the external application can cause some amount of hyperreaction related to the dominance of the Prakriti of the particular person. When you are practicing Panchakarma in the Grishma Rutus, especially Shirodhara, Shirovasti, or the Parishekas like the Pejichil kind of thing, Shachikashali also to some extent, you should be extremely cautious. Like due to the Grishma Rutucharya or the Grishma Rutu, there is every chance that patient may have some amount of dizziness or some amount of hypotension, some amount of disturbance in the under the procedure when he is going through. Of course, the Kerala Shastriya Paddhatis, like the traditional things, Talam is one of the mandatory thing when you are doing the Bahya Mahan Swedas, it's a mandatory. But sometimes when we are practicing without these, and sometimes even if we are using this, there is a chance that some of these complications may happen with respect to the dominance of the Prakriti also, Pitta Prakriti person. Acharya has very clearly told, whenever there is a Rutu, which is Viparita, or the extreme conditions are there, then actually you can practice if it is Atyayika. When it comes to Atyayika, so you can Vikalpya Kratrima Guna Upadanena Yata Rutu Guna Viparitena Beshajam Sanyoga Samskara Pramana Vikalpanema Upapadya Pramana Vidya Samam Kritva Tataha Prayojiyet Tamena Yatnena Vita. That means you are compelled to practice. Of course, this type of the clinical compulsion can happen because of the various reasons. Like it is whether it is really an Atyayika condition, or sometimes it is a compulsion of the physician part to complete the particular therapy in a given period of time. So if such is the situation, then how to execute the Panchakarma? Because gone are the days in the long days when Acharya mentioned that Gangayaha Dakshinanukule in the southern part of India, you will find Pravrata Rutu. In the northern part, we will have the other Rutu, the comparatively 6 Rutus are there. Now you don't find these 6 Rutus now in the practically speaking. Practically speaking, you don't find the 6 Rutus. Especially in the southern India, we have dominantly 2 Rutus. One is the Varsha Rutu, another is the Ushna Rutu. So only 2 Rutus are there. So if you keep on avoiding Panchakarma, like totally you should abandon the practice of Panchakarma, which is not possible. So you are supposed to make some adjustments so that Panchakarma is practiced without much complications. So adopt the Acharya who has given you the permission to see that you can use some amount of Kritrima Gunapadhanena. And also you have to see that how to practice Panchakarma in a particular Prakriti dominant person. So the relevance of the Prakriti comes there also. How to practice Panchakarma without having complications, especially when it comes to the Pitta Prakriti person. So adopt the Pitta Prakriti concepts in the Rutus, especially the Ushna Rutus, whether it is the Grishma Rutu, whether it is Sharad Rutu, whether it is the most of the times in the southern India, more than 6 months it will be hot weather. So in those times when you are practicing Panchakarma, so you should adopt such kind of adaptation so that you will not land up in the complications. So I think most of the things I have covered. especially there is a lot of the chances of having lot of discussion over certain areas of panchakarmas. It's open for the discussion. Sir, I am obliged and privileged to have you in the presentation. Thank you so much, sir. You have blessed me.
Hello, Dr. Shripati.
Yes, sir. Yes, sir. Thank you, sir.
This is a fantastic presentation.
Thank you so much.
More than a prakriti, all the other aspects, we should be careful while doing Panchakarma. You described very well about Kosta, about Kala, and even Devya. While you are with so many examples, you first of all talked about Gulgulu Diktaka Hrida. As you rightly pointed out, it is a fantastic drug. It is a broad spectrum antibiotic-like action for that. It works in different systems.
Yes.
And I think Satmam is also one of the points we have to be considered while doing Panchakarma. You described about different countries, people, how they react with Panchakarma treatment. There, Satmam is one of the main points. And you described also Varanadi, Prasaranyadi, in relation to Kala, in relation to Prakriti, all these things. I'm very happy to hear from my students these fantastic classes. Thank you.
It's all about your blessings, sir. You have guided us in such a way. Thank you so much for coming into the presentation, sir. Seeking your blessings.
Thank you, sir.
Thank you. Thank you.
Today, Dr. Arun also joined, and Subin sir also joined.
Is it?
Jiggy sir is there.
Doctor,
Subin is also there.
Madam, you are not audible.
Dr. Rajgala, thank you very much for conducting this type of program.
Thank you, sir. Thank you, sir. Thank you. It was like for my students, I thought that there should be something for Panchakarma from the Panchakarma experts. And that's how I started, sir. It's all your blessings, sir. Thank you, sir. Thank you, sir, for joining and encouraging us. I think there are any questions from the audience? No. Only someone, Dr. Shripati, Mubin Patel has asked like muscular dystrophy treatment possible. The question is, I think, is there with Panchakarma, muscular dystrophy treatment is possible or not? Something like that.
It depends on the type of muscular dystrophy, of course. There are certain muscular dystrophies. There is some echo or something. Yeah. So many times we see that in the management of the muscular dystrophies, we see that quality of life can be improved, lifespan can be improved. And in some of the muscular dystrophies, some of them are like, within the age of some 30, 40 years, usually there will be very complications may appear. But in the other clinical types of muscular dystrophy, there is a good improvement is possible. We have seen with the, Vata Kafaja line of management, especially initially there is a very much need of Rukshana Chikitsa. So Rukshana Chikitsa with respect to the Bahya Chikitsa, we adopt especially the Udvartanam with the Kolakulatadi Churnam with the Dhanyamlam. And of course, Vinod sir is there, who is very much fond of the Dhanyamla. And we use it in the clinical practice with the Kolakulatadi Churnam and Dhanyamlam. And also, we remember it, sir. We remember it. Yes. Yes, sir. So, and also we use Tikshna Vastis, in fact, here. I used Vaitarana Vasti also with the Gomutram in the initial phase of the practice. Then once the Kapha Nirharana happens, Kapha Avarana is removed, then the Snehana Chikitsa can be adopted. There is a good improvement in the flexibility. There is a good improvement in the movement. The muscular size of the dystrophy areas where the pseudomuscular atrophy is present, that has reduced in size. So these things are possible, but I don't say that it is a permanent result. So there is a need of repetition of the therapy in due course of time. and quality of life can be improved with the repetition of the therapies.
Yeah. Thank you, sir. One Veera Mohan has asked, like, can Prakriti change in a person's life? And she has told, before gym, that Prakriti was something.
Yeah. No, madam. Prakriti is basically comes with us with the birth. It won't change. What is the importance of the Prakriti is, when we are dominant of a particular Prakriti, when you identify that I belong to a Vata Prakriti, I belong to a Kapha Prakriti, and you will know that what is good for you, what is bad for you. And there are certain diseases which you are prone for. Like being a Vata Prakriti person, I can predict that in future I may get a disease of the joint disorder or neurological diseases I may be prone for. Then you can take all the measures so that you will not land up in particular diseases. That doesn't mean, that won't guarantee you that you can avoid the diseases, but at least you can take some precautions. You can postpone the particular diseases. Like for example, in the case of Prameha, he may be prone for kapha like disorders like the bronchial asthma or the Prameha or the obesity, etc. So if you take proper measures, that what should be the diet for the kapha prakriti person, or the chikitsa, like for example Vasanta, Vamana, etc., then at least you can postpone it, or you can minimize the effect of the particular prakriti, side effects, etc. You can avoid it, such things. And Acharya says that always you should try to come back to the normalcy. What is the sama prakriti? From the vata dominant, pitta dominant, kapha dominant, you should try to come to the sama prakriti. It is only the effort you are supposed to make. You can't change the prakriti as such.
Yes, sir. The assessment might be the wrong. That might be but Prakriti cannot be changed. Vishakrame. Yes. I think there are no any questions.
Good evening.
Yeah.
First of all, thank you so much, sir, for sending me the link and I could join the class. I have a question that you mentioned few gritas. I wanted to know, is there any grita which can be used irrespective of the prakriti, for anybody, which will work on their condition also?
See, basically, there is no such gratas as such. You can use it for all the doshas. When you are doing some samskaram, every dravya will have a effect on the particular gratas, because samskarasya anuvartana will be there. Even though grata is retaining its own property, the dravyas will have its own effect. Like, he says giving by the example of Chitrakadi, grata, etc. But Acharya says that there are some Sastra Yogas, like, some of the dravyas like Hindu Kanta Gratam or the Mahatiktaka Gratam, etc. Even though it is used in the Pitta dominance or Vata dominance, etc., to some extent, these gratas can be used in some of the conditions. Sarvamayantaka grata, actually, Shastra says, but definitely there is an indication for certain diseases. So you can use Samskrita grata, which is just Murchita grata. You can use it in if you think that if you don't want to focus on any particular dosha dominance, so you can use the Murchita grata at least.
Okay, sir. Thank you. It was because sometimes it gets confusing to identify it's easy to identify the disease, but not the prakriti of the person. So I was like, is there anything in such cases if I could give something? Thank you, sir.
Sure.
Yes, sir. So now, thank you so much for joining and giving such an amazing lecture to our students and those who have joined online. On behalf of the Department of Panchakarma, I thank you all for joining. And
thank you for giving a good opportunity to at least go through. And it will be a rehearsal or revamp of that thing. Like that Rwanda PG days. Yes. So sir is there. I think it was again recollecting all the wonderful opportunity. Thank you so much.
Yeah, thank you, sir. It was a wonderful lecture. All students are very benefited, and on behalf of the students and department, I really thank you. Thank you so much, sir.
Thank you.
Thank you all who have joined online. Thank you so much. Namaste, sir. Namaste, sir.